that we can all learn together. And it's good to see a couple of people I have worked with, others we are still working with. Really a delight to see you all in the house. And that's why collaborative effort is the only way we can win. Of course, we know why we are here. It's because each and everyone logged in has a passion for care, has a passion for making that difference. So as we talk about service excellence, let's just take a back step and ask ourselves, why is health a global, regional, and national agenda? And as rightfully as Carol has put it, of course, in line with our SDG 3, whereby we need to talk about good health and well-being. So of course, this was drawn from the SDG conversations that were being set up by the UN. And it takes us back to seeing that indeed, the poor health generally in the country, in the globe, is one of the reasons why healthcare is a global burden to all of us. And the reason why we continue to focus on it, because as a society in totality, we have various aspects that weigh in or bear to what we're talking about, our social and our economic impacts on our general well-being as individuals and as a country and as the globe. And again, health is an investment. If we are not well, we are not able to really do much. So when we look back at where we have been and where we are in this pandemic era, then we can actually see that health is a key agenda, and if underscored, actually an agenda of value. And that's why we have taken out time this morning for all of us to be able to just come in and have this roundtable conversation around how can we provide excellence in healthcare. Of course, again, security and protection to all of us is very key when we talk about our human or our health security. And that is why we need to ask ourselves, what is it that we are going to change after today, or even as we are going along? Because as we say, everybody has a little of what they can bring into the conversation. So very quickly, as I said, I love to engage. I would like you to take out your phones and go to www.menti.com. I'm sure you'll also see it on the chat room just now. And once you're at www.menti.com, I would like you to put in a number that we are going to share on screen just to answer the question that you will see come up. So please log into www.menti.com. I'm just sharing my screen shortly. I would like us to do a poll on the same. In one way or another, we have been a patient or we have supported someone in healthcare. And Carol brought it out very well, that we would love, of course, to get the very best. We would not take our family member where we can't get the very best. So ask ourselves in this point, I would like us to look at it as a patient. I'm the one receiving care. What exactly is it that I feel is my biggest pain point? So I hope you can all see my screen. Please go to www.menti.com and use the code 10672516. It's also in the chat room. Yes, thank you. And we can begin to see the polls come through. So I'll just be silent a bit so we can go through that in the next at least 45 seconds should be good, because I know we are fast learners. So what is your biggest pain point in access of healthcare? Yes, let's get more responses. We only have 3. We are 52 of us in the house. Thank you. At least we have 10 responses. Oh, waiting time and clinical engagement is almost going neck to neck. Let's see. Let's get a few more. Mm-hmm. Okay, at least we're at 14. Let's get a few more. We can see waiting time, clinical engagement, still at neck to neck. Okay, great. The rest of you can keep your polls coming in as we continue with this conversation. So it's clear that so far waiting time and clinical engagement is a big pain point, yeah? And then it directly speaks to what we were mentioning earlier, personalized care. That all of us would love to receive personalized care. All of us would love to be recognized at that hospital setting, to be whisked in and get the very best of service. So we can clearly see that. I can see a few others said, one other said mindsets. That's only one person who talked about a mindset change. So it means maybe not too bad in terms of the people. Then in terms of clinical engagement, came in second so far. And clinical engagement again, because again of the personalized care. So when we talk about service excellence in this new era we are in, because we are definitely in a new era, it has shifted, we've got to move with the times. Unfortunately, we may not go back to where we were, as much as we are kind of stuck in the old and hoping we could go back. The fact of the matter is that we may not be able to go back. So how are we going to position ourselves for this new era? And this new era comes with a shift one of our mindsets. I love the conversation around shifting mindsets because we've got to adapt to what is here with us. When COVID struck, we all didn't know how to handle COVID. It's a year down, a year and a half now down, and we are pushing on. We've moved into these virtual spaces and are able to engage. But of course, at the end of the day, we are the same human beings, the same social people who'd love to be together. But then in healthcare, a lot has happened. How are we going to position ourselves to ensure that we are going to offer patient-centered care? Or, as one lady has reminded us, I think that was Florence, look at it from the service industry, the hospitality industry, like Kenya Airways, whereby the client is not called just a customer or a client, it's the guest. So when we talk about this new era we are in, what have we seen shift? We have already seen a conversation that has shifted around the patient being the center of care. And I'll demonstrate how that has happened. Because for all of us, in one way or another, we have now seen more value in the care more than the cost, because everybody is looking for the very best care. So whether we like it or not, it has now moved more from that cost element. I know we have my fellow insurers in the house. Yes, cost is still key, but we can still control that cost if we look at the value of care and still be able to drive down the bottom line. And why we are saying in this service and in this new era that the service excellence has shifted to the patient, or now the guest, as we may borrow that word for this conversation, is shifting or has shifted, is because we have seen that care now has even moved from just being in hospital into having more agile systems at home, where we are talking of home-based care. Because the center is on offering that client, that guest, the very best service. So whatever multidisciplinary functions that we require to offer that patient-centered care, it then means we can offer it anywhere as long as we have all the required resources. And when we talk about those resources in terms of service excellence, because we've got to demystify and ask ourselves, how are we going to meet SDG number 3, good health and well-being is by one, ensuring we partner around all the other goals of the SDGs. But then in terms of service excellence in healthcare, it means it's got to start with me, myself, for example, as Effie, having the passion for what I do. Because you could be in that space and don't have the passion to deliver what you're doing. And when you realize you don't have the passion, it affects all the other 4 pillars you see before you. And it's amazing. You'd have thought we discussed this with Carol. We didn't discuss what I was going to present. She even brought out the 3 Ps out of my conversation. And it's out of us asking ourselves within these 4 pillars to offer excellent service. What can I do as a person and as a group of people? It's one, identifying our priorities in healthcare. Already, from the national and global agenda we have for healthcare, we know that healthcare resources are constrained, but how do we bring them out as a priority for us as a nation? It's by what we are having today, a roundtable conversation to discuss what are the priority areas. And one we've already identified is service excellence. And it's already an area that we can see there's a shift in terms of that priority of care, whereby priority of care now has shifted to the agile of being able to receive home care right at your home, being able to have that IECU or EECU at home, being able to give telemedicine or telehealth solutions as a priority to ensure we are offering service excellence. So the other critical pillar is about us, the people. And that is why I'm very passionate also about training people for excellence in healthcare. And I'm excited because out of this conversation, I look forward to partnering with ICX such that we can also develop other healthcare programs that speak to the market, because it's all about access. How are we going to partner for access and for that service excellence, and to be able to attain good health and well-being for our people as a nation and for our families and for our communities. So when we talk about people, we, the people, must also begin to enhance or be empowered or engaged or really look around how we can improve on our resource as the people. So that speaks to training, that speaks to conversations of collaboration, so we can enhance that perspective, and also to our patients or our guests, whereby we engage and empower them to own their own healthcare. There's one person I love to listen to who is very vibrant and always talking about healthcare. And one of the conversations he speaks to is the fact that when he was in clinical practice, and the challenge he found while he was in clinical practice was that patients would keep coming back for treatment. And he would ask himself, why are they having these repeat cases, repeat UTIs, all that, and they come back. And when he does his head-to-toe checkups as the clinician, he really didn't find the reason why they needed to come back. He realized that the people were not empowered enough to care for their own health. So when we talk about the people, it's our clients, it's our guests, if we're in the service industry, because we all are different stakeholders in this house. Are we empowering them enough to own their health? Or even us here today, are we empowered enough to own our health such that I don't need to keep visiting the doctor? I should only visit the doctor as and when is necessary. And I think one of the things we can see that has clearly happened in this new era is the fact that people are not necessarily just going back for reviews as previously. It has boiled down to owning your health. If you have parents in the village who would come for treatment, they're not very keen to come anymore because they are looking at other ways of owning their health and managing the chronic condition, be it said so. Or are we developing also robust enough programs in wellness to support this? All this speaks to the people who are very key in delivering this service excellence, because it will also reduce our burden on the healthcare system where everybody does not need to come for healthcare services. And another key pillar is the process, because all of them are hinged under that passion. For you to develop these 4 building blocks or pillars that you can see before you, it starts with your passion. And after your passion, it moves to you now looking at the solutions. Are you a solution provider around these perspectives? The process is very key. And one of the things that the studies around that have been done, especially in this new era by KPMG, the Deloitte, around what is shifting in healthcare, is looking at various processes. And one of the key elements that has been picked is that service excellence and organizational excellence will have to change and shift. And we'll talk a bit more towards the end about this. How is it shifting in terms of patient care, in terms of medical plans that have been offered even by the various organizations? But it has to start from that area of passion again. What's your passion for what you're doing? Because it can only start with you having that passion to deliver service excellence. And then your purpose. You really need to identify what you're called to do. Are you serving today in an industry that you don't like? Because when you don't like it, that is what you give back to the people. I always say you can't give what you don't have. So your purpose, your connection, your calling, if it's what makes you jump out, get out to work, definitely you are in the right place, because you will love doing it and it will grow and expand your horizons. So looking at these 4 pillars in terms of our passion, then we need to critically ask ourselves, why are we here? And what are the quick things that we are going to do to move with this shift? We've discussed them as a team, and we know we've seen what's happening, but just to give it a push so that we can look at it together and collaborate and push together for performance and move away from just being, but moving away from looking at we have the potential as the people, we have the potential as institutes, we have the potential as organizations represented here, but it's time now to move to greater performance, which means we've got to look at the bigger picture to be able to attain or live within even our Vision 2030 as a country around healthcare sustainability. And then that is why it would be very critical for us to ask ourselves, are we moving with the agile or agility of this new era? Because after every era, we've seen change. After 100 years, change comes in. So here we are. Agility has happened for us. It's happening. We've got to catch the bus. We've got to move. And when we talk about more strategic and agile supply chains, it's one. For example, home care. I see Dr. Msafiri in the house. I mean, he's really made a mark in the industry. Anyone looking for home care supplies, that's one facility. And I know there are probably many others who are offering home care in this platform. But moving on and saying that nothing is going to stop you from being agile enough to offer that healthcare solution where you can. And so it calls for us to ask ourselves, what is this that we can do in this new season? Because the impact is great and it will come from all of us looking at those opportunities. And one other big opportunity or quick win that we see from this conversation of this new era on this shift is patient consumerization. As we have said earlier, we've seen the patient has moved to the center, or our guest has moved to the center of care, whereby we are saying value is more important now in terms of quality care. And we're saying that the same way we today can sit back where we are, order our lunch, order our shopping through Jumia, go online platforms, Amazon, the rest, get what we need. It's the same thing we are all looking for in healthcare. Patient consumerization, that there could be a change that I could actually reduce on that waiting time, which was a bottleneck or a pain to us in healthcare, and be able to actually go online, book my appointments, get to the doctor's office on time, and be seen at that exact time, not be kept there waiting. One of the things I dread is actually going like for my dental appointments with my children, because sometimes the queues are crazy. Yes, you're booked on time, but you still have got to wait there longer enough. So for me, one of my pain points is waiting time. But again, I'm excited with the service within that dental unit because it's friendly. It's beautiful. You can get to enjoy the gardens. You can get to have a cup of coffee as you eat. So it's more personalized, but the waiting time is a pain point, and it's a conversation we are having. But the service chain around it is amazing. So it kind of alleviates the burden of waiting, but it's still not yet what I would really love. I would love not to be on a waiting queue. And that is why we are seeing patients now moving to the telehealth solutions. But do we have sufficient to support our country? We are not yet there, but of course there is work that is really going into it. So that consumerization, the patient being aware, what can they access online would really also be a quick win and a big impact to all of us. So where we can innovate, this is a time to continually innovate. Again, personalized care, I can't overemphasize, being a very quick and big impact solution for all of us. And that's why, again, we are seeing the agile supplies in terms of people moving for home care, or people now working with personalized doctors who are more readily available than probably the senior most consultants who they would wait for previously. So all these things are really bringing a change to the healthcare space. Workplace diversity and safety, conversations that really are engaging. We are now in a gig economy again. Generations in the workplace are different. We can now see the baby boomers being phased out. So we have more millennials, Generation X coming in, and then we'll soon have the Zoomers who are still in school, but very soon joining, a few of them, especially as they come for internships. And how they work is not how we work. At least majority of us on this platform, we will need to continually change that mindset. And that was why mindset was also a key conversation there. How they are coming in and plugging into the workspace is also in a very diverse way. So we've got to accommodate them. We've got to understand that there are people who want to move with intentionality. They're very authentic. They're very, go-getters. They don't just sit back and wait. So how are we going to accommodate them to ensure that we make use of that value that they carry for service excellence? Let's begin to welcome them to the workspaces. Let's begin to engage them. Let's begin to get that creative mind out so we are able to have quick wins from these generations that we have today. Virtual care, we're already here, for example, having virtual conversations, but virtual care remains very critical in terms of our support as healthcare practitioners, wherever we are, as the various stakeholders in the house, looking at expanding that, because we are not going back to where we were. This is a new normal, and indeed a great shift for all of us. So we've got to move with a fast train, catch up on it, and keep moving. Artificial intelligence, automation, it's already in the market. We are seeing also a large space taken over by this, especially around the diagnostics. We'll see again more movement taking place, even where maybe diagnostic centers were within the hospitals being moved away to be able to offer even better and diversified services as standalone units. So a lot is going to happen, and new paradigms again in infrastructure. Sorry for that spelling error there. So new paradigms in infrastructure again. I think one of the things that we saw with COVID is that COVID came, changed how healthcare is managed, changed how hospitals were supporting or giving healthcare services and delivery, made some hospitals literally close out units because of the aspect of infection. So again, as hospitals are being built, we are going to see a shift in how that is coming on, and more private facilities available as opposed to just having open wards, because we have seen the need from this era. So that again is going to change. So in case we are thinking of building facilities, we need to look at all these things that are going to make us have a different look or a different lens into this conversation. Mergers and acquisitions, again, within the healthcare sector is going to take a lead. And again, even from a perspective of having organizations that are not necessarily healthcare, but are looking at wellness as a key factor for them joining healthcare conversations. And what do we mean? For example, we have Walmarts that are already doing wellness programs, chronic disease management programs, because they have realized they have the database, they have the clients, and there's a need, there's a niche, and they have the, again, automation ability. So they are coming in, they are being able now to offer chronic disease management programs and wellness. So we'll see wellness not only being a healthcare conversation, but again, a more strategic conversation moving away from not only the healthcare players, but people who have interest in offering wellness. As Carol put it earlier on, it's been a season of course, distress, a season where we've had people also in mental health really crashing down because of the various stress factors. And so you can see there's a huge need and a huge gap to be able to go into the space of wellness and offer solutions that are lasting. So the question is, what do you have in your hands to be able to be that purpose-driven person that is going to offer these conversations or is going to offer a solution to their markets? And the last but not least is the pair shifts. Whether we like it or not, corporates today are not able, majority of them, to meet the premiums required for healthcare as before. So what is going to happen, or what is happening, is some of them are not able to renew. So they're either reducing their premium, others are walking into hospital facilities to find out whether they can have direct engagements with them because of the weight of the financial burden to them. And this will mean that also hospitals will also now begin to engage on a one-to-one with clients to offer quote unquote medical insurance, or what we would call like a HMO facility. So the various pair shifts will happen. Medical plans will also have to change from the insurance sector, whereby probably microinsurance now may take the lead because of the aspect of lack of financing ability. And because we know that healthcare is a key agenda to all of us, and for it to offer that value, then we must collaborate to be able to come up with all the solutions that are going to speak to us and have opportunities that are going to help us all to win. It's all about us collaborating for a winning performance and to push for service excellence. So when we look at all these aspects, at the end of the day, they are actually improving the service excellence. Today, if you ask those who've gone virtual, who've had telemedicine conversations, who've had their supplies delivered to their doorsteps, they are happy. Of course, the element of social interaction may be a missing link, but slowly by slowly, people are loving it. Slowly by slowly, people are taking on home care solutions. So as this shifts, even for the hospitals in the house, how are you going to remain sustainable? How are you going to still offer high value care? Because it's all about the client that we need to care for. So I welcome conversation, discussion. I only had 15 minutes, of course, a very broad area to talk about, but for me it's to really emphasize the pillar conversation. We must have passion for what we deliver. If we don't have that passion, we cannot deliver. We'll under-deliver. And you can't give what you don't have. And then we need to be socially aware of what's happening around us so we can continually push for excellence. So I welcome conversations of, I welcome collaborative conversations that we can all push for excellence in the various areas we are working at. Thank you, Carol. Maybe over to you just to moderate any questions coming in.
Yes, Effie, you have just warmed my heart as well. I have abandoned and ditched my love for the other Effie. You are my current bae. You have said such important things. And what you've said last is really it. How do we collaborate? It's a collaboration. It's not us and them, you and me, and so on. How can each and every one of us collaborate so that we can then take healthcare in this nation to the next level? What I'll invite from the team is please put your questions on the chat. What we want to do out of this engagement today is to put together a report with action plans, because our meeting is only as good as the actions that come from it. And we'll invite you, Effie, to collaborate with us so that we can look through these actions and then share them with everyone. And these actions are not necessarily tied to healthcare, because when you look at Effie's pillars, when you look at your pillars, Effie, those pillars are for everybody, anywhere, in any organization, whether it's product, whether it's service, whatever it is. And so therefore we need to then look at that and see what are our next steps. So So we'll thank you so much, and we love you, we honor you, we celebrate you. Thank you for putting together this powerful presentation. I have enjoyed it very much, especially the pillars and the opportunities. Pillars and opportunities. Those slides were really good. Would you be so kind as to share the slides with our guests? We are calling them guests today, with our guests on this. So we will share with you the slides. Please join our WhatsApp broadcast. It's not a group. We don't send crazy forwards in there and stuff. We'll put the link on the chat, and that's where we shall send Effie's great presentation and the report as well. And so therefore, thank you so much. Let's conclude this conversation today. And to conclude it, I want to conclude it in honor of an excellent group of people called Customer Experience Possibilitarians. If you are not part of this group, today I'm just challenging you. If you're not part of this group, you are missing very sizzling hot customer experience conversations. Yesterday, a conversation showed up, and the conversation was labeled the 4 Fs. And these 4 Fs of customer experience excellence have played out today. And so in honor of the Customer Experience Possibilitarians, please join this group. Someone put the link in the chat to have people join this group. It's a WhatsApp group. We are very sane in this group, and we just talk customer experience excellence to grow customer experience to the extent where the government will sit down and listen to us at policy level. That's what that group is about. So in honor of the Possibilitarians, there are 4 Fs that are coming out of today's discussion, the round table and Effie's presentation. F number 1 is find it. Find it. Let's find 2 Ps. Let's ask ourselves, what exactly is the problem? Find the problem. Find it. Find it, name it, put it down. Question number 1. And in find it, we're not only finding problems. The second P is find the PowerPoint. What point do I have that's so powerful that makes people come back to me over and over again? So I'm finding my problem and I'm finding my PowerPoint. Put that down. Once you put that down, we move to the next F. The next F is fix it. Fix it has 2 C's. Fix it by changing it. Change that problem. Fix it by fixing it in place. Whatever your PowerPoint is, remember that P, champion it. Champion it so that it doesn't just occur once. So fix it has 2 C's and find it has 2 P's. And the next F is follow up. And follow up has 2 I's. Follow up what you have found and fix so that you can inculcate that change that you have put in place. Inculcate it. And follow up so that whatever your PowerPoint is that you're championing, you can innovate around it time and time again. Because when you find a good thing and you don't innovate around it, then it ceases to be a good thing. So we have 3 Fs, find it, fix it, follow up. We have 2 Ps, find the problem, find the PowerPoint. We have 2 Cs, change it and champion it. And we have 2 Is, inculcate it and innovate around it. We are going poetic today. This is how we roll as customer experience possible.